Hello, everybody. Welcome back to another episode of The Root of the Matter. I am your host, Dr. Rachaele Carver, and today we are really fortunate to have one of my colleagues and one of my good friends and somebody who helps me be a better human being. Katie Kitzing is here with us. She has a master's in counseling, is a drug and alcohol counselor, and how I use her as a certified emotion and body code practitioner. So, Katie, thank you so much for getting up so early and having this conversation and sharing all of your wisdom with our audience. Why don't you tell us a little bit about what brought you into counseling and how you found this emotion code and body code work?
Yes, thank you so much, Dr. Rachaele, for having me. I'm excited to be here. Yeah, I will say in general, I didn't grow up in the functional medicine world. I didn't know much about it. I just grew up going to normal, like MD doctors. So that wasn't in my background at all. But I got my bachelor's in social work out in Eastern Washington University. And while I was in that program, I got certified as a drug and alcohol counselor. And when I graduated from that program is where I landed a job at an inpatient center, a treatment center for youth who struggled with pretty severe addictions. And it was a really hard job. It was really rewarding. And I just remember thinking when I was working with those youth, wow, I wonder what I can do to understand like what drives these addictions more. And so I did that for a few years before I started moving a little bit more to an outpatient basis with adults. And I remember feeling, gosh, clients are in these programs for such a long time. I wonder what I could be doing to be better at really figuring out like what drives their addictions and how can they become recovered from this so they can live the lives that they're meant to have. And at that point, I remember thinking, gosh, I might have to go back to school. And so I can start to understand the deeper roots of what's going on in people's hearts and what's the trauma that I'm not able to address as just being their drug and alcohol counselor. So I went and got my master's in professional counseling at Grand Canyon University. And that's what opened up a whole new world for me. And when I completed that program in 2018 is when I first started working at a partial hospitalization program, which is essentially a day treatment for clients who struggle with more acute issues. Maybe they have more severe anxiety, depression, and maybe some suicidal ideation or self-harm. And I was finally feeling, okay, I can get to the root of the issue here and I can maybe help these people in a deeper way than I had before. But I found that even then I was observing, I'm seeing, okay, they're learning really great skills and it's really helping them. They are on medications, but people are only getting just a little bit better, just a little bit better. And I thought, gosh, there's so much more I am missing here. I can't quite articulate what it is, but it just feels like there's more that I could be exploring to help people heal. So that's somewhat of my professional background. And then my personal life kind of converges with this, which tells you a little bit more how I got into what I do now. So in about 2019 is when I was introduced to nutrition response testing or muscle testing. And I stumbled into that because I knew people who were doing it and I was looking for a more like functional root approach to some of the struggles I was having, mostly anxiety, feeling chronically stressed, feeling rushed all the time. And I had historically tried counseling and I tried a couple of psychiatric medications. And I thought, I don't feel a whole lot better. And I kind of have these negative side effects in the medication. Like, why don't I try a deeper rooted approach? And when I was introduced to nutrition response testing and muscle testing for the first time, my brain completely broke. I could not compute and understand that the body intuitively knew what was going on with me. And I just left thinking, my body knows what's going on and what the problem is. And my body knows what the solution is. It knows exactly what it needs. I was speechless. At that point, I might have had maybe a professional crisis, thinking I might have to walk away from everything I've ever known in the counseling field because I need to work with the body because the body has these answers that I just don't know myself. And so I sat in that place for a while. Do I leave my career and pursue something with the body like nutrition response testing? Thank God it didn't come to that because the practitioner who I was seeing is someone who I work with now. She ended up doing some work on me on an imbalance in my body and could not find any nutritional root to the issue. And there was no toxicity, there was no nutritional depletion, anything like that. And she said, Katie, I don't do this for a lot of people, but because I don't do emotions, that's not her lane. She's not comfortable with it. She said, I can test to see if there is something emotional going on with whatever imbalance is in your body. And I was like, absolutely, please do that. And when she found the root and she found the emotional connection here and she cleared the issue and the imbalance in my body was gone. And that was when my brain broke even more, but then came back together. And I finally realized I don't have to leave the field that I'm in. I can actually incorporate something else that will allow me to maybe get into the body and to figure out what is going on. So she was the one who introduced me to the emotion and body code. And that's where I am today and why I use both of those. I use that model with my therapy and I also just use it as its standalone service.
And it's fabulous. And I love it. And I love working with you because I think through my journey, I've also learned that we have to take this more holistic WH, right? OL approach to health and well-being. And as you said, it was really interesting in your early career. You're like, oh, there's something more. Like you just knew it intuitively that there was something more that you could do to help people. We've talked about on the podcast before these childhood traumas and all these kind of things that they literally get buried in our bodies. And then they can have physical responses years later. And so when we are just attacking or trying to treat the physical body, we see it all the time that people get 80% better, right? And then, what is that last little bit? How do we get them over the hump? And that is when we see the emotion work, working on those values. And it's tricky because a lot of our values and ways of thinking are in our body by age 6, before you even know that there's any issues there. And so we're always, even through our adulthood, are working through those filters of a 6-year-old, right? And so your work is really great. This whole emotion code body work helps to uncover. So for example, let's say, maybe give us an example of somebody comes to you for emotion body code. I'm trying to think what one of my first things they came to. I work a lot with my kids too. I have Katie work on my kids because they're not at the stage right now where they want to go to counseling, but I know they've got lots of traumas from me, whatever. And so Katie's really great helping me work with my kids, like anxiety, right? My younger daughter, I'm like, why does she's not very good, like with friendships. And I'm like, what is stopping her? So something like that, give us an example. So for my daughter, we worked on Ruby before. We talked about why isn't she more outgoing? So tell us a little bit about the process.
Yes. So the emotion and body code is you use muscle testing approaches to ask the body yes or no questions to explore what emotions, maybe belief systems, maybe trauma or other imbalances are contributing to whatever issue the client is coming in with. And in your case with your daughter, it might be that someone's coming in with the experience of, I don't know why, but I just don't seem to want to connect with people. Or someone might come in and say, I have a compulsive behavior and I don't really know why I do it. Or I have chronic anxiety or sleep issues. That's the beauty of this work is you can come in with really anything that is just causing an interference in your life. So it could be emotional, behavioral, but it also could be physical. There's a chronic skin issue. I've been working on it for a really long time with my nutritionist. It's gotten a lot better, but I'm wondering if there's an emotional root to my skin issues or my chronic left hip pain. That was one of the issues that motivated me to do this work is just chronic left hip pain, trying to figure out what emotional roots are going on there. So yes, various issues like that is usually what bring people in. And trauma, of course, is one of the things that's always fascinated me. I remember starting to be very interested in trauma before I started doing this. And we were learning a lot more. Okay, so trauma gets stored in your cells. And we know this, there's enough evidence to support it. We're learning about how we're operating unconsciously from those places. But I remember just thinking, then what do we do about it? We know that it's there. We know we're living out this trauma, but how do we get it out? And I was learning about some of the well-researched trauma modalities like EMDR and prolonged exposure, which are great modalities. But I always found myself more interested in the traumas that people weren't really aware of. Instead of I know that this happened, it started here, and then this happened, and then it ended here. Those are the type of traumas that people can rehearse verbally. They have a memory attached to it. It's in their declarative memory. And so they can work through something specific. But for all the other people that came in or who I was working with, who they were just saying, I literally don't know where this came from. I don't have a memory. I don't have an experience that would justify why I think this way. Those were the ones I'm like, what do we do about that trauma? One if this occurred when the person was 2 and they don't have a memory of it. Or one if this is actually a generational trauma that came from their mom. How would we know that it came from there? And then what do we do about it? So yes, I usually will get people who come in with like difficult to articulate issues, which is no barrier to this type of work. They can just go, I don't know, it's a thing. I don't want to connect with people. I don't know why. We could explore it because there usually is something there that we could find.
Yeah, and it's amazing because in this work we can look for, is there a toxicity, right?
Yes.
Is there a nutritional balance, or is there some long thought belief? I know we've worked together. We've gone back, what, 9, 10, I forget the last one, maybe 16 generations or something. Sometimes it's one of the things I was like, I feel weird about money. Like I'm always don't have enough.
Yes.
And this is weird because it's not reality. So I asked Katie, I'm like, let's unpack this. Like, where does this come from? And that went back many generations to one particular like ancestor who there was trauma surrounding that. And it's so interesting how those can be passed through multiple generations. And we're seeing that, and there's lots of evidence to show this. So it may not even be your emotion or your trauma, but you're carrying it in your DNA.
Yes.
So that's really fascinating. And I think that's important what you're saying. So you were talking about the big T traumas, right? So if you were abused emotionally or physically, that's an obvious trauma, but it's the little hurts, right? Or the things that are passed down through that we don't understand why we behave a certain. So we can unpack it by, as you said, just simply asking these questions. And so I think it's absolutely fascinating. Do you want to give us some maybe examples of some people that you've worked with and help them overcome some certain things?
Yeah, definitely. Gosh, I've worked with so many people with various different things here. I've had people come in, and a really common symptom that people come in with is digestive issues and or just anxiety with food. And oftentimes when there are emotional associations with food, undoubtedly the person's going to have trouble digesting their food. And it makes it very murky to figure out what is the problem with food. Is it that you have an allergy, or is this a gluten intolerance here? Is there a microbiome imbalance here? And so oftentimes we will find that it may not be trauma, but significant emotional experiences that have happened, whether it's with them or maybe it is generational. Maybe their parent had emotional experience and food was around. And the brain has tucked it in a little category and goes, okay, food equals stressful because I was in this emotional experience where I felt a lot of shame. Or I have now created a belief system around food, or not even around food. It's just a belief system about who I am as a person. I am an unworthy person, might be the belief. And when I have food, that shame is exasperated and now it's just generalized to food. So I've seen some people improve when it comes to those digestive issues or just feeling a little bit less stressed when they're eating. General hip pain, that is something I see a lot with women. It's very common for that left hip to experience discomfort when the uterus is out of alignment. And the uterus and the reproductive organs often show up when there's emotional experiences with family members, with a parent. And so I've had sometimes people come in, it's just one appointment, and they go, gosh, I have been working so long to get rid of this hip pain. I stretch, I do acupuncture, and we'll do a little bit of work. And wow, I can't even feel the pain anymore. So things like that happen all the time. And it's always so rewarding to see the progress. Other people take a little bit longer because there's layers. And so you just never know what you're going to get. Is it going to be a quick healing? Is it going to be slow and progressive? You get all in between.
That's great. Tell us a little bit about the addictive behavior. Have you seen any patterns of what maybe like in early life may predispose them? Is it all genetics or is there a specific trauma? Is there any patterns that you've seen around addictive behavior?
Gosh, I might have seen some patterns. I try to stay super open because I know one thing Dr. Bradley and his team, that's the creator of the Emotion and Body Code, they always hone in. Anything could cause anything. Anything could cause anything. And so I sometimes notice patterns, but I try to just keep it totally open because I don't want my bias to go, oh, I know this is totally what it is. But I often will find with compulsion behaviors, for one, toxicity seems to be a theme. When the system is overwhelmed with whatever toxicity it is, the body is stressed. So that almost always will show up. But emotionally, there usually is some type of either prenatal, so something is going on in the womb. Their mother was experiencing something stressful, but also generationally. Very rarely is it just this person's life that is influencing their compulsion behavior, whether it is binge eating or substance use, anything like that. So emotional traumas for sure, generational traumas, toxicities. And yeah, those might be the three things I typically see.
Yeah. And it's interesting when you say that, like trying to be open minded. That's what I love about muscle testing.
Yes.
My practice, right? I may look at somebody, look at their mouth and say, oh, you need magnesium, right? Or you need XYZ. We need to support your liver. We need to XY. And I'll bring down some supplements. And I'm surprised all the time. I'm like, oh, what? Because what I thought from my educated, experienced mind that they would, but no, the body says, no, thank you. So I think that's the real value in working with somebody, whether it's nutritional or emotional. Just the body is one big ball of it. And so it's important that you have a practitioner who is open-minded and is willing to let go of the frontal cortex for a minute, right? And just tap into the energy, because I think that's how we have some more successes, by really listening to the body. There's that book, The Body Keeps the Score.
Yes.
And everything's in there. I think there's just so much value to this energy work. And it's exciting now because there's more and more evidence, more and more research showing how well it works. And those of us with chronic diseases are at an epidemic level in the world today. And conventional medications, even just supplements, are just not cutting it anymore. And so it's really important that we individualize everybody's treatment. And even in the dental world too, have insurance come all the time or associates, and I tell them, I treat people, not teeth, right? Because every tooth is attached to a human being, and there's so many. I see a ton of time emotions. People have pain in their teeth, right? There's no obvious decay. There's no obvious infection, and yet the tooth is really bothering them. Have you seen any, like TMJ is one of the big ones, right? We see a lot in young women specifically. That just started what the statistics show. Have you treated anybody for any tooth or jaw?
Interestingly enough, people don't seem to come in with that, but I feel like recently in the last month, I can't tell you how often the teeth and TMJ are showing up and they go, oh yeah, that's actually a problem for me, but they didn't come in with that. And I often find like the TMJ issue is connected to the kidneys almost always, and the kidneys, they do a lot for the body. But I also find that, oh, your body is suggesting that one of your teeth is misaligned. And that's significant because every tooth is connected to different organs and different glands. And oh, maybe that might explain a little bit why your knee is hurting or why your liver might need support. And it was mind boggling for me to see that those connections. And yeah, a biological dentist was also something I wasn't aware of. And so I just think it's fascinating the connections in the body.
Oh, all the time. I've seen so often a person will get a joint replacement, right? And then a month or two later, the tooth on that same side of the body starts bothering them. And again, you don't see any evidence of physical decay or anything. So
Right.
it is really interesting. Every single tooth is an organ. It has its own energetic base. So that's interesting to think about the TMJ and kidney. We think of kidney as where our essence, right?
Mhm.
Is like we're born with a certain amount of essence or chi or prana or whatever life force, right? Whatever you want to call it. So it's interesting. And kidney stress majorly impacts the kidneys and it takes away some of that life essence. Yeah. So that's really interesting. And that's what we see too, oftentimes in TMJ experts. So it's stress less. Do something about your stress. Easier said than done, right?
Absolutely.
So that's kind of work that you do really comes in hand. Okay, I know I'm clenching, I'm stressed at work, but we think all of us think that our job is like the most stressful and stuff. But if anybody can have stress,
Right.
but it's interesting this emotional. How do we create resilience, or where does this stress come from? Because again, everybody can have stress. Some people deal with it better than others. So when it comes to, I know I used to think of myself when I was younger, yeah, stress doesn't bother me, but it builds up over
Yeah.
time and I can be quick to react instead of, okay, just take a breath, everything's good. So thinking back, okay, why do I get triggered? What are those triggers? Right. Because that's hard for when you're in relationships with somebody and trying to have proper
Yeah.
communication. If somebody says something and it triggers you, like then trying to have that meaningful conversation and conflict resolution that becomes really challenging as a
Right.
parent, right? If you're easily triggered by something your kids do, then are you teaching your kids a good lesson or are you creating more trauma and stuff like that? So
Yes.
I think it's really this kind of work is so fascinating to try to understand yourself and the way you interact with others. And one of the things I came to you too about was that, I can't seem to find an associate. I know where I live makes it more
Mhm.
challenging. What I do is more of the special kind of dentistry,
Right.
but but do I have an energetic block
Right.
and so we worked on that a
Yes.
lot too, is opening myself and what is I'd like to kind of work by myself, wanted to work for myself. So how do I open that up and say, okay, but now I'm ready. Like I invite somebody into my system,
Yes.
and get rid of those blockages. I think that's super exciting. And I love doing that work. And it's a continuum. We've been working together for months and I don't feel like I'm like there's a beginning and an end to there really is. And sometimes I'll call on you like, I'm having a moment. I need help with this one issue. But otherwise, it's just like in general, working on here's what I want to achieve and
Yes.
help me work with those emotions and see things in a better light or whatever. Help me work on myself,
Yes.
because I think
You're like, it's like
that's
the
very
maintenance thing. You're right. I said sometimes people want to know, okay, so how often do I need to come in and do this? And I think, okay, I'm not thinking like I am when I'm in a therapy session. It's okay, let's see each other weekly before we go bi-weekly. This is more like you can feel it like a massage. Like you can feel when you need to go get some massage work done and you can engage with the emotion and body code like that. If you came in once a month, even if there wasn't an acute thing that you were bothered with, you're going to experience benefits because we're living. And so we're going to experience stress and there's going to be something your body wants to work on. And even if it was once every 3 months, that we could just continually benefit from this work, even if it was just semi-regular. And to your point too, why are we so stressed all the time and what could we do to help with that? That's one of the things I love about this is I almost imagine that all of our emotional experiences are stored in our body like big rocks. And we are just weighed down. It's like that term people use, emotional baggage. I thought that was more symbolic. And I take that to be very real now. We are truly carrying the baggage of our emotional experiences. And once we start to remove those big rocks, we have more capacity to deal with the day-to-day stressors. And Then there's just the other piece. What could I do to be protecting myself to not be so vulnerable all the time so that stress doesn't impact my body? And that's where the nutritional work comes in. Because when we have toxicities, if we're eating a diet that's full of processed foods, our body is going to be living in a chronic state of stress, and we will not be able to handle the emotional stressors that come. But then there's also just doing things to protect ourselves energetically. I'm a Christian. I pray the armor of God every day. God, please put this your shield of protection over me, that I am not vulnerable to other people's emotions, that I don't leave at the end of the day taking on anything that I worked on with a client. And that does make a big difference for us. And we could and should all get in the practice of saying, nope, I block myself off from other people's energies.
Hey, it's super important. My oldest daughter is an empath, and so has stress, she has anxiety, and it is because she absorbs so much of that energy. So from a young age, we've been trying to teach her, like, how do you create that barrier? How do you create the boundaries so that you don't let that affect you? Because that is, and so many people today, especially these young kids, are walking around with all this anxiety and all the impact of that social media that's in their face at all times. That's a stressor. We don't kids say they get on it to relax or whatever, but they don't realize that stress of that constant information, not to mention the blue light and all the other stuff, the Wi-Fi and all that stuff is an addition stressor. So creating this resilience. So for those of people listening who maybe don't know, we've talked about muscle testing obviously on this podcast a lot, but maybe don't totally understand it. So let's say we have this emotion buried in our body. Can you explain a little bit about how you get rid of it? What is the process of releasing?
Yes, great question. And there's lots of different ways to release it, but I usually start by explaining to a client who just has no concept of what do you do? Is this witchcraft? And no, it's not, but it is very wild. It's very wild. So I usually explain that our body has this built-in memory bank of everything that we've ever experienced. And muscle testing can be used to ask yes or no questions to the body to see, is there an emotion here that's influencing this particular issue? And if you think about it psychologically speaking, I think we've all kind of had those moments where we had an aha moment. We didn't know why we struggled with something. And then we go, oh, wow, actually, maybe that's why I struggle with this issue. That makes so much sense. And suddenly the issue doesn't bother us anymore. It's because it's come to our conscious awareness. And that is a lot about that's half of the work of what muscle testing and emotion and body code does. It brings out the information that we already know that's in our unconscious, and it is now in our awareness. So even actively as we're doing testing, these things are releasing because we're aware of it. But then I usually take an extra step. So I work with a lot of clients who are Christian, and I usually will spend the session praying, and I pray over the imbalances that we find and muscle test at the end. And the body responds and says, yes, I release these things. But guided imagery and through the power of intention can also be used. So sometimes I have clients that will close their eyes and they will use a sense of imagery of all of these emotions that I found. I imagine them leaving my heart space. They say it out loud. I give my body permission to let this go. I have some clients that choose to tap on different meridian points because the EFT, emotion freedom technique, that's known to help release emotions from the body. And then a lot of practitioners use magnet therapy. I chose not to go that route, mainly because I wanted to find a little bit more of a easier transition into using this work with my therapy clients. To suddenly start using a magnet with them felt a little weird, but the magnets do work, and a lot of practitioners will release emotions through magnets.
Yeah, I know the emotion code book he explains how to use the magnet and you draw it right over your head.
Yes.
And what is the mechanism of that? Why would you draw it over your head? What is that tracing?
So the main meridian in our body is the governing meridian. It starts about our lip and it goes all the way down, back down your spine. And it's that main electrical current in our body. And the way that it's described, it's when you take the magnet, you could use the positive side of a magnet and you have a negative energy in your body. It's almost as if you are erasing it, much like when you put your Like someone takes your credit card with a magnet, you can clear the information on the credit card. It's like that. And sometimes people don't even have a magnet. They might even use their hands because we have a lot of polarity on our hands. You could use your hands. Sometimes people will swipe on their hands as well, but it is a true clearing from the positive energy to the negative, neutralizing that information.
Yeah. And I think I love that analogy you just said with the credit card, because it's a lot of people think, oh, that's so woo. But yeah, like how many times have you ever been to a hotel and you put your stinking key card right next to your phone and it gets wiped out? So
Exactly.
it's a simple thing. It's all about charge,
Yes.
charge in our body, everything in the universe has
Yes.
charge. So that's what we're doing. Emotions have charge, right? And this is how this works. Just because you can't see the emotion doesn't mean it's not there, right? And that's where sometimes you have to distend your belief, let it go a little bit and just believe, right?
Yes.
Because how can we read heart rhythm? How can we read brain waves? It's all
How do lie
electrical.
detectors work, right? These are all things of the electrical world, the frequency world that we're using. But I have found that I had to work through some serious mental blocks with going into this work, because anything in the energy world, anything that God created, the enemy will use to pervert. And so when I think the average person that I know with the circles that I'm in hears the word energy and hears the word frequency, and they go straight to witchcraft, they go straight to new age. And I was like, oh my gosh, is this the world I'm walking into? And I really had to look at it from a scientific perspective and recognize it for what it is. And it is, everything is energy and frequency, and we can use it to bring restoration in our body. And I'm so thankful for that.
When I started learning this, it doesn't have to be religion versus science,
Right.
because this is what made me believe in Jesus's, because I'm like, okay, I was so scientifically oriented going through all my schooling. And I was like, I was brought up Christian too, and thinking, Jesus, oh, okay, these people are making this. But then you think about energy, and I was like, he was like the premier energy healer.
Totally.
And it made me just believe in this even more, that they don't have to be separate, but one.
Yes.
God and energy and all of this together. And I was like, wow, okay, I really can get on board with all of this now, not just imagine that these things happen because it's a good story, but hey, I can see with the power. I've seen it time and time again, this energy healing. I think it's fascinating to think like this. And when you talk about that governing meridian, it makes me think of too, in the mouth. Sometimes when we have metals that cross over, if you have a metal partial on the top of your mouth, or braces even, or any kind of wire across the top teeth, that kind of is interrupting that smooth energy flow of that governing meridian.
Yes.
We also talk about like tongue posture, having that tongue on the roof of the mouth is connecting, right? The governing meridian with the conception vessel, right? So there's one down the front of the body, one down the back.
Yes.
And that part on the palate is where those two energy pathways connect. Wow. It's really interesting. So I moved away from doing any metal crossing the midline, right? It's on one side or other, not as much, but when it specifically crosses the midline, we can see interruption in cerebral spinal fluid.
Wow.
And that energy. So it's really interesting. So I'm like, oh, I try to avoid that in all possible cases, right? A lot of people might have wires in the front of the teeth. So take out the metal and we can use fibers now, which is great. So we don't have that interruption in the energy. People don't think about that. All the metals in their mouth, right? When we have dissimilar metals, we have an electrical current going on there. This is all related and really interesting how it all comes together there.
Fascinating to think about. I know my husband has wires down his spine from a previous surgery that he had, and it was connected to this little thing right there in his body. And while he got part of this removed from his body, those wires are still in there. And I often think, gosh, what is this doing to the electrical flow in his entire body? Even though the doctors say it's not going to do anything, it's not affecting you. I'm like, you have chronic back issues, you have chronic low energy. I can't help but wonder about that.
Yeah, I mean, it's fascinating when you think about all it and how everything works together.
Right.
But in traditional scientific world, that the energy doesn't come into play, even though they'll use the energy to look at the heart and look at the brain. I haven't quite gotten that far, but it's surprising more in the main media it is now, because people are looking for answers, because conventional is only getting them so far. So we're seeing this source of, and think about all the wearables people have today, right? To be able to track your heart rate variability and your sleep and all this stuff, which is awesome. I love trying to teach people to be their best doctor, right? You are the only person who knows your body, the way you're feeling and thinking and all this. So having all of this kind of technology, there's pluses and minuses to technology, obviously, but it's nice that there's this availability so we can track our own health and try to catch these things before they become so massive that they're more challenging to deal with. And I wanted to bring you on so we could talk about this other aspect, right? The emotional, the spiritual, all of that with that, and becoming aware of that when we're dealing with some chronic issue. Is there also, yes, there may be toxicities, but is there the underlying emotional issue why we can't get over the hump? And it's wonderful. It doesn't hurt. It's not invasive. You can do it from the comfort of your own bed.
Exactly.
Yeah. Katie's way out on the West Coast. I'm on the East Coast. And so that's great. The whole idea with being able to use Zoom and all these different modalities now, we can get the best of all worlds. We don't have to be in a city.
Exactly. It's brain breaking. It's brain breaking. I thought, I don't even understand the ins and outs of quantum entanglement. And yet that's the mechanism used here for me to do a distance test with another person on the East Coast. Unbelievable. Unbelievable. And I'm so thankful for it, because then there isn't a barrier for someone to get healing. And I'm so grateful.
Yeah, me too. But it is amazing. Like, we didn't even touch on that. Like, we don't even have to be in the same room, which is really, again, it creates that ability to get all this work no matter where you are. So why don't you tell us a little bit more about your Honey Holistic Health, and how, if somebody was interested, how would they work with you or learn more?
Yeah, so I work at a small wellness center called Honey Holistic Health, and it was originally a place where Andrea Espinoza, she is a nutrition response therapist. So she does all the nutritional side, checking out the physical health of your body. And then I came on board and I do the emotion and body code. And I also do mental health therapy for clients in Washington. And so for those who are interested in exploring both the nutritional roots and the emotional roots to whatever symptoms they have, that's what leads them to come to Honey Holistic. Our website is honeyholistichealth.com. And Honey Holistic Health is also where you can find us on Facebook or Instagram as well.
Awesome. Katie, this has been wonderful. Thank you so much again for taking time so early in your day to come and educate all of us. Again, I can't tell you how much I've loved working with Katie. She's really helped me in so many ways, and she's just a wonderful human being with a wonderful heart. And so I definitely encourage everybody to check out Emotion Code, Body Code, learn a little bit more about it, and maybe it's that missing piece of the puzzle for you. So I hope you all enjoyed this episode. Please let us know what other topics you'd like to hear about. And otherwise, we'll see you all on the next episode. So have a great day, everyone.
Thank you so much.
Hello, I'm Dr. Rachaele Carver, a board-certified naturopathic biologic dentist and a certified health coach. Did you know that over 80% of the U.S. population has some form of gum disease? Many of us don't even know that we have this source of chronic infection and inflammation in our mouth that's been linked to serious consequences like heart disease, diabetes, stroke, dementia, colon cancer, kidney disease, even pregnancy complications. Would you like to learn how to reverse and prevent these chronic debilitating conditions without spending a lot of time and money at the dentist? Join me for my 6-week course where I will teach you the root cause of disease. You'll learn how to be your own best doctor. Are you ready to get started? Let's go.